Hi, my name is Olivia O'Sullivan, and today I will be presenting on how diffusion-tensor imaging and tractography is applied in preoperative planning of intraaxial brain lesions. A little bit of background behind this paper. In surgical planning for brain tumor removal, surgery is aided greatly by knowing the proximity and relative positioning of the tumor to certain regions of the brain. The aim of this present study is to assess the role of DT, tractography, DTT, in preoperative mapping of major white matter tracts in relation to brain tumors. The study is also aiming to show an important role of DTT in assessing tracts affected by the tumor and to utilize this information in guiding surgeons to maximize the tumor resection, thus minimizing post-operative neurological deficit and chances of tumor recurrence. A bit more background behind this specific study. Gliomas are the most common brain tumor that diffusely infiltrate surrounding white matter tracts of the brain. Conventional MRI is commonly used for tumor localization and characterization. However, this does not give precise information about the white matter infiltration surrounding the tumor. Since the MRI routinely demonstrates the lesion without any precise information about the involvement and integrity of these white matter tracts surrounding the tumors.
In order to combat this problem, diffusion-tensor imaging, or DTI, was developed. Diffusion-tensor imaging with tractography is currently the only available tool which displays the white matter tracts disruption by fractional anisotropy, FA, and fibers reconstruction in patients with malignant brain tumors. DTI is a non-invasive magnetic resonance technique. It measures white matter tissue integrity and tractography, or fiber tracking. It is used to investigate the preferential directionality of diffusion. DTI allows for the visualization of white matter tracts in the immediate vicinity of brain tumors that permit maximum tumor resection. This is because once we can adequately see where the tumors are in relation to the white matter, we can remove the malignant parts of the brain while keeping the white matter healthy parts intact. The relation of tumors with the white matter tracts, deviation, infiltration, and disruption has been one of the most important initial applications of DTI.
DTI is derived from diffusion-weighted imaging, DWI, which is based on the random water diffusion in each voxel. DTI adds directional information by providing three maps. 1, the apparent diffusion coefficient, ADC, 2, the FA map, and 3, the directionally encoded color-coded map, DEC. We will now go in a little bit deeper into these three different maps. The first map, the ADC map, is a voxel by voxel measure of the magnitude of diffusion. ADC of a tissue is expressed in units of millimeters squared per second, and it helps to quantitatively measure the magnitude of diffusion of water molecules within a tissue of the brain. The second map, fractional anisotropy FA map, is used to measure the preferential directionality of diffusion and is expressed as a numerical value between 0 and 1. A high FA indicates a great degree of preferential directionality, i.e. the highly organized white matter tracts of the brain. Conversely, a low FA indicates a less preferential directionality, i.e. the gray matter of the brain or the cerebral fluid regions of the brain which have an FA value of 0. The third map, the DEC map, provides color-coded maps produced by the FA calculations. By convention in the field, blue represents tracts traveling from the interior end of the brain to the superior direction of the brain. The green represents tracks traveling from the anterior to posterior direction of the brain, and the red represents tracks traveling from left to right. Fiber tracking or tractography imaging can be performed by different algorithms based on the preferential diffusion direction within voxel. Tractography can allow for three-dimensional visual representation of neural tracks, like in the images seen below. This is important because doctors often need to see these tracks that aren't seen in normal MRI imaging. The relationship, however, between FA and tumor cell density is still widely debated, and different algorithms are believed are preferred by certain scientists over others. This has created a dilemma for neurosurgeons and may result in overestimating the destruction of neural fibers, which is an issue in tumor removal because we want to keep the most healthy tissues intact as we can while removing all of the tumor cells. The study discussed in the present paper aimed to show this important role of DTT in assessing tracts affected by tumor and to utilize info in guiding surgeons to maximize tumor resection with the goal of minimizing post-operative problems, whether those be tumor resurgence since not enough tumor cells were removed, or combating issues in removing too much healthy white matter tissue. DTI data was processed using a diffusion toolkit, which is a free software that can be found online. And it was completed by extracting imaging from 3 case studies. The first case study, imaging, is seen below. The case involved a 38-year-old male with left glioblastoma for the case, and an MRI exam initially revealed an intraaxial tumor in the left temporal parietal region of the brain. His brain imaging are shown below, along with normal intact left-sided CST, IFO, and AF tracts for comparison. The FA map showed a decreased value, indicating infiltration and destruction of white matter tracts. The color-coded map showed complete disruption of the white matter tracts of the IFO fibers, and the 3D fiber tractography showed intact left CST close to the lesion. The left CST was shown to be compressed and deviated medially by the mass lesion. And once again, these are shown next to normal tracks for comparison. Imaging that was taken for another case, case 2, is shown below. In this case, a 34-year-old female was used that had developed partial epilepsy with transient language disorder. MRI initially showed the left insular lesion characteristic for low-grade glioma. Pre-operative DTI was completed and demonstrated the relationship of a lesion to eloquent areas to allow maximum tumor resection and to avoid tumor recurrence and damage to vital areas, such as the language and motor function of this female. Axial whole brain tractography showed destruction and distortion of left frontal fibers and the left IFO tract. Imaging from the third case is also shown below. In this case, a 24-year-old male was used for the study. This male presented with frontal right parietal glioblastoma. The FA and color-coded map showed decreased FA value and destruction of white matter fibers. 3D tractography was initiated from the brainstem for CST. The right CST passing through the periphery of the lesion was compressed and deviated anteromedially by the lesion. Visualization of the white matter tracts by DTI is increasingly being used for neurosurgical planning, and these three cases have exemplified why this is the case. DTI allows preoperative non-invasive 3D demonstration of the tracts, which guide in surgical planning of the superficial and deep-seated brain lesions. Maximum resection of gliomas reduces the risk of tumor recurrence, while ineffective chemoradiation can result in loss of vital brain functions and poor quality of life. The precise location of the white matter tracts in relation to the lesion helps the neurosurgeon in preoperative planning by defining the surgical access point and identifying the extent of tumor resection while preserving vital motor, visual, and language brain functions. DTI provides in vivo tissue microstructure information by measuring water diffusivity for a given voxel in terms of FA and MD. By combining the data with other studies, the authors of this paper found the extent of tumor resection and post-operative improvement of locomotive function of GT group to be significantly higher than those of the control group. This case study provided the imaging of this technique and showed why it is useful in preoperative planning. DTI can be acquired in intraoperative rooms and in some cases preoperative unidentifiable CST were trackable on intraoperative scans due to change in local mass effects by tumors on adjacent tracts. DTI-based surgical planning in selective patients can represent an alternate procedure to awake surgery that is often used today. In conclusion, this paper reflects how diffusion-tensor imaging, or DTI, is a valuable tool in modern neurosurgery, as it can identify multiple white matter pathways involved by intraaxial tumors. The three case studies show it can identify multiple white matter paths in both males and females and of different extent of tumor. Thus, this technique plays an important role in neurosurgical planning and in predicting the extent of safe resection. As in these cases, it can be seen that the DTI can be used in conjunction with other imaging modalities for a more holistic pre-surgical planning technique. However, there are also high variabilities in the sophistication of this modality, which limit the interpretation of results, thus warranting more studies to optimize and simplify fiber tracking. So the future of the field is reliant upon identifying more precise algorithms that distinguish between white matter tracts and tumor cells. Progressive improvement in scanning as well as software-based methods of fiber tracking can overcome these limitations and help neurosurgical planning. Thus, the field is turning towards this and more studies are being conducted. Thank you for listening about this paper on diffusion-tensor imaging and tractography application in preoperative planning of intraaxial brain lesions. The paper was conducted by scientists Nityu Soni, Anand Mehrotra, Sanjay Berher, Sunil Kumar, and Nishant Gupta.